There are millions of elderly people who go in for routine exams every year under the impression that they are doing the right thing for their health. These checkups are often seen as proactive measures, ways to catch problems early, monitor existing conditions, and stay ahead of any major health issues. The belief is that the more informed you are, the safer you'll be. That's what we've all been told. But what would you say if I told you that some of these very tests could actually increase your risk of having a stroke, sometimes overnight, without any clear warning? Doesn't it sound hard to believe? It might. But the reality is that modern diagnostic procedures, while incredibly advanced and helpful in many cases, can also carry hidden risks, especially for individuals over the age of 60. You might be thinking, but I trust my doctor, I follow all their recommendations. And that's perfectly valid. You trust your physician. You adhere to every recommendation made during your appointments. You show up on time, get the test done, and follow the advice you're given. However, the hidden risks aren't usually highlighted in the brochures you get your clinic. They're not part of the headlines in the news. And sometimes, even your physician may not fully understand or communicate the subtleties of how certain tests might affect older, more vulnerable systems. Imagine you go in for a checkup, everything seems fine, and you leave the office feeling reassured, relieved, even, but then, a few days later, something changes. You start feeling dizzy. Maybe your vision becomes blurry, your balance feels off, or your speech slurs. You're suddenly in the middle of a serious medical emergency, and you're left wondering what just happened. The truth is that certain diagnostic procedures, especially when done frequently or in the presence of underlying health conditions, can have unintended consequences. These procedures can trigger sharp rises in blood pressure, interfere with normal blood flow, and start a chain of reactions that might increase the risk of a stroke or cardiovascular event. This is not meant to scare you, but rather to inform you so that you can take a more active role in your health care and protect yourself and your loved ones. After 60, it's no longer just about identifying what could go wrong. It's about avoiding the things that could be making matters worse without our knowledge. Let's talk about one such diagnostic procedure, the CT scan with contrast. This is a common imaging test that many seniors undergo. You may remember the sensation, a warm flush that spreads throughout your body when the contrast dye is injected. That sensation happens because the contrast is traveling through your bloodstream, helping to highlight blood vessels, tissues, and organs so your doctor can get a clearer image. At face value, it sounds like a good thing. Better images mean better diagnoses, right? But there's more to it that many people, especially seniors, are never told. That little injection isn't as simple or harmless as it seems. If you're over 60 and dealing with high blood pressure, heart issues, or kidney problems, the contrast dye used in these scans can actually put stress on your cardiovascular system. It's not always visible or immediate, but the effects can be dangerous. In some people, the contrast can trigger what's called a vasovagal reaction. This is a sudden response that causes your heart rate and blood pressure to drop sharply. It may lead to lightheadedness, nausea, fainting, or even a brief loss of consciousness. That's scary enough on its own, but in other cases, the opposite occurs. Blood pressure may spike instead of drop. The dye can irritate sensitive blood vessels, causing them to spasm or constrict unexpectedly. When that happens, especially in someone with pre-existing cardiovascular vulnerabilities, the risk of a stroke or heart attack increases significantly. This isn't just a hypothetical situation. A study published in the Journal of Vascular and Interventional Radiology found that older adults who received contrast-enhanced CT scans were more likely to experience vascular complications within 72 hours of the procedure. The risk was highest among patients with existing conditions like hypertension, heart disease, or kidney impairment. The more fragile your internal systems are, the more potentially harmful that contrast dye becomes. Let me share a real-life example to help illustrate this. An 81-year-old patient went in for a routine abdominal CT scan after experiencing some minor bloating and discomfort. Nothing severe. He walked into the clinic feeling relatively fine and expected to return home afterward with a better understanding of what might be causing the bloating. The procedure itself seemed to go smoothly. However, within 48 hours of that scan, the patient began to feel disoriented. He reported vision problems and felt unusually fatigued. A family member noticed he was slurring his speech. By the time they got him to the emergency room, doctors confirmed he had suffered a minor stroke. What makes stories like this so troubling is that they're not isolated. They're not extremely rare, but they also aren't widely discussed. That's the problem. Seniors deserve to know about the risks, not just the benefits, of the tests they're being asked to undergo. It's not about fear. It's about informed decision-making. You shouldn't be afraid to ask questions. You should feel empowered to speak up, especially if you have a history of cardiovascular or kidney issues. Ask whether a scan truly requires contrast. Ask whether your body is in the right condition to tolerate it. Get your kidney function checked beforehand. Talk to your doctor about alternatives or timing. These conversations could make a critical difference in your outcomes. As we grow older, our bodies become more sensitive to these medical interventions. What once was a routine procedure in your 40s or 50s might carry different implications in your 70s or 80s. The risks shift, and so should the strategy for managing your health. Medicine should be about partnership, not just prescription. If you're watching this video right now, leave a 1 in the comments if you're over 60. If you're younger, drop a 0. Either way, let us know where you're watching from by mentioning your country in the comment section. We'd love to connect with you and build a community that supports each other through informed choices and shared experiences. Don't forget to subscribe for more information like this. Information you won't always hear in a doctor's office. Now that you understand how even something as routine as a CT scan can carry hidden dangers, you'll be better equipped to advocate for your health and make smarter decisions moving forward. Let's continue this journey together. Discomfort in his digestive system led him to visit the hospital. He underwent a scan, and the results came back normal. Feeling reassured, he was discharged and returned home in good spirits. However, just 2 days later, he experienced a short-term stroke. So what might have caused this sudden turn? While not common, one possible explanation lies in the contrast dye used during the scan. It's plausible that the contrast injection triggered a temporary spike in his blood pressure. This abrupt rise could have dislodged plaque or contributed to the formation of a clot, leading to a blockage in the blood vessel supplying part of his brain. That's how a seemingly routine scan can, in rare cases, contribute to a cascade of events resulting in a stroke. Now, this doesn't mean that contrast-enhanced CT scans are unsafe or should be avoided altogether. In fact, they can be life-saving. These scans have the power to detect hidden tumors, blood clots, internal bleeding, and even aneurysms. Without them, many critical conditions might go unnoticed until it's too late. However, and this is crucial, they should never be used casually. These are not tests to be scheduled on a whim or as part of a routine checkup without a clear reason. Every diagnostic tool, especially one involving contrast dye, must be used with thought based on individual health needs. So, how can you protect yourself or your loved ones from unnecessary risks? Start by engaging in a serious conversation with your healthcare provider. Ask them directly, is this scan necessary for my case? Is there an alternative method available that doesn't require contrast dye? These questions are not confrontational. They are responsible. Make sure your doctor is fully aware of your complete medical background. This includes any history of kidney disease, high blood pressure, heart issues, or allergic reactions to contrast dye or medications. These details could change the type of scan recommended. In many cases, non-contrast CT scans or even ultrasounds can provide enough diagnostic clarity. For some conditions, a simple MRI or an imaging study without dye might be sufficient and safer, especially for older adults. The key point is, you have options. Don't hesitate to ask for them. While technology can be powerful, it should always be used with precision and caution, particularly in individuals with complex health histories. Now, let's shift our focus to another type of medical test, one that is widely used, even encouraged, especially among older adults. It's the stress test, also known as the exercise stress test. At first glance, it sounds like a smart precaution. After all, who wouldn't want to see how their heart performs under pressure? The concept seems reasonable. Strap on a heart monitor and walk or jog on a treadmill while your heart is observed. But there's a catch. For individuals over the age of 60, especially those dealing with conditions like high blood pressure, heart disease, or weakened blood vessels, this test may present more risk than benefit. Let's look at why. As the treadmill speeds up and your exertion level rises, your heart rate climbs and your blood pressure increases. For a younger, healthier person, this might be no big deal. But in older adults, particularly those already living with health challenges, this sudden cardiovascular demand can push an already strained system to its limit. Think of it like igniting a spark near dry brush. You may not see the danger immediately, but the conditions are primed for trouble. Some of the potential dangers include sharp spikes in blood pressure, irregular heart rhythms, also known as arrhythmias, and even small tears in fragile blood vessels, especially those in the brain. While these side effects are rare, they are not unheard of. A study published in the American Journal of Cardiology in 2020 examined more than 1,300 individuals over the age of 65 who underwent treadmill-based stress tests. The findings were sobering. Approximately 7% of those tested experienced adverse effects. These included unexpected elevations in blood pressure and abnormal heart rhythms, outcomes that could have been avoided in some cases with a more tailored approach. Now, let me share a real-world story that brings this issue home. Margaret, a 74-year-old woman from Ohio and one of our loyal readers, had been managing high blood pressure for years. She felt fine and was simply attending a routine checkup when her doctor suggested a stress test, just to be safe. During the treadmill portion of the exam, Margaret began to feel lightheaded. A tightness developed in her chest. The staff halted the test immediately, but the damage was already done. By the next morning, Margaret had suffered a mild stroke. Doctors later explained that the rapid elevation in her blood pressure during the test had caused a small vessel in her brain to rupture. While the test itself didn't directly cause the stroke, it acted as the tipping point, exerting force on an already delicate system, triggering an event that could have been catastrophic. So what's the key takeaway from all of this? You must speak up. Ask your physician whether a different method might be more appropriate for assessing your heart's health. In many cases, a nuclear stress test, which uses medication to mimic exercise instead of requiring physical exertion, might be recommended. Alternatively, a resting echocardiogram could be used to evaluate your heart's function without the strain of exercise. These alternatives may offer similar insights but with reduced risk, particularly for older patients or those with pre-existing conditions. There's no denying that modern diagnostic tools have revolutionized healthcare. From advanced imaging scans to stress testing, they allow for earlier detection, faster intervention, and better outcomes. But that doesn't mean they're always the right choice for everyone. Age, medical history, and current symptoms should always be factored in. Just because something is available doesn't mean it's the best option for you at that moment. The key is informed decision-making, and that starts with asking the right questions, understanding your options, and being proactive about your health. So, whether the scan with contrast or a treadmill stress test, always remember, your health is unique. Protecting it means staying informed, staying cautious, and making sure every test and procedure serve a clear and necessary purpose. Senior citizens often undergo a variety of medical tests to stay ahead of potential health issues. However, just because a test is commonly performed doesn't always mean it's necessary or without risk. If you're not currently experiencing symptoms like chest pain, shortness of breath, or unexplained fatigue, it's worth asking your doctor whether the test being recommended is absolutely required right now, or if it can be safely postponed. Many procedures that appear routine or harmless can carry hidden risks, especially when certain conditions or medications are involved. One such test that has become increasingly routine for people over 60 is endoscopy. Whether it's to inspect your esophagus, stomach, or colon, an endoscopy is often suggested by medical professionals as a precautionary measure. Sometimes, that precaution makes perfect sense, especially if you're having symptoms or if there's a known concern. But here's something that most people aren't told. An endoscopy, particularly when done under anesthesia, can potentially do more harm than good if it's not medically necessary. While the procedure itself is usually safe, the associated sedation and interaction with common medications taken by older adults can introduce serious risks. Most adults over 60 are taking at least one form of daily medication, and many of them are on blood thinners, such as warfarin, aspirin, or Plavix. These drugs are essential for preventing strokes and heart attacks, but they also make it harder for blood to clot. During an endoscopic procedure performed under anesthesia, it's normal for your blood pressure and circulation to shift. In younger individuals, the body generally handles this shift well, but in seniors, especially those on blood thinners, this change can increase the likelihood of internal bleeding or complications with blood flow to the brain. That's where things can get dangerous. In 2021, a comprehensive review published in the journal Gastrointestinal Endoscopy found a clear increase in transient ischemic attacks, TIAs, also known as mini-strokes, in patients aged 65 and older within 72 hours of undergoing sedated endoscopic procedures. While these weren't full-blown strokes, they were red flags, early signs that something disrupted the blood supply to the brain. These are not symptoms you want to ignore, especially if they could have been prevented. One particular case still stands out. A 76-year-old woman underwent a routine colonoscopy under anesthesia. She had no noticeable symptoms and no urgent need for the procedure, but it was done as a precaution. 2 days later, she began slurring her speech and had trouble coordinating her movements. At the emergency room, it was confirmed she'd had a minor stroke. Doctors believe that the drop in her blood pressure during sedation, combined with her regular use of aspirin, created the perfect conditions for a small clot to move and cause the damage. This isn't to say endoscopies are inherently dangerous, but the combination of sedation, age, and medication create a high-risk situation, one that may have been avoidable. That's why it's important not to agree to an endoscopic procedure unless your doctor can clearly explain why it's needed at this time. If you're not currently experiencing symptoms and it's been several years since your last screening, ask if it's possible to monitor your condition instead of undergoing an invasive test. Most importantly, always let your doctor know about any medications you're taking. That includes not just prescription drugs, but also over-the-counter medications and supplements. You should specifically ask whether you need to stop taking your blood thinner before the procedure and what the risks of sedation are in your specific case. If you're uneasy about being sedated, ask whether the procedure can be done without anesthesia or whether there are safer, less invasive alternatives. When thinking about common procedures that carry hidden dangers, another one that deserves attention is the MRI, a powerful imaging tool that's often used to detect early warning signs of serious health issues. MRIs have revolutionized diagnostics. They can provide detailed images of organs and tissues, help detect conditions early, and even prevent unnecessary surgeries. But there's a part of the MRI process that many overlook, the use of contrast dye, which is often administered to improve image clarity. And this is where extra caution is needed, especially for seniors or anyone with reduced kidney function. The contrast dye used in MRIs often contains gadolinium, a heavy metal that enhances image quality. The problem is that gadolinium isn't stable in the body. It needs to be filtered out and eliminated by your kidneys. That's a natural process, but as people age, their kidney function naturally declines. Between the ages of 60 and 70, this reduction becomes more significant. And if you're someone who already has chronic kidney disease or even mildly impaired kidney function, your ability to eliminate gadolinium from your body is compromised. If gadolinium stays in the body too long, it can accumulate in tissues, including the brain and bones, and potentially cause long-term damage. In rare cases, especially in those with existing kidney issues, it can trigger a condition called nephrogenic systemic fibrosis, NSF, a serious and sometimes life-threatening disorder that causes fibrosis of the skin, joints, and internal organs. Even though the risk is low, it's real, and it's important to be aware of it. Sadly, many seniors undergo MRIs with contrast without being properly screened for kidney health beforehand. All it takes is a simple blood test to check kidney function, but this step is sometimes skipped, especially if the procedure is ordered quickly or on short notice. So if your doctor recommends an MRI that includes contrast dye, don't be afraid to ask why it's necessary. Ask whether your kidneys will be tested beforehand, and whether the MRI can be done without contrast. In many cases, high-quality images can still be obtained without using gadolinium, especially if the risk to your kidneys outweighs the benefit of enhanced imaging. The takeaway here is not to fear medical testing. but to approach it with awareness and caution. Tests like endoscopies and MRIs can be incredibly useful, even life-saving. But they're not without risk, especially for older adults on multiple medications or with underlying conditions. Ask questions. Speak up about your health history. Understand what's being done and why. And don't be afraid to request alternatives or second opinions when something doesn't feel right. Your health is your responsibility, and being informed is your best protection. A function that has not yet been fully recognized may cause your body to struggle with clearing gadolinium as efficiently as it typically would. In such cases, small quantities of this substance can remain in your system for extended periods. This lingering presence, although seemingly minor, can actually pose serious health risks. Gadolinium, a contrast agent commonly used in MRI scans, has been linked to a rare but serious condition known as nephrogenic systemic fibrosis, or NSF. This disorder is significant in that it affects the skin and connective tissues, causing them to become increasingly rigid and thick over time. When the condition progresses, it can severely limit a person's ability to move or even breathe comfortably. In some cases, organ function may also be compromised. The issue becomes even more concerning when we consider that most people are unaware of a deeper danger. Gadolinium has also been found to accumulate in the brain tissue of some individuals, raising serious concerns about its long-term neurological impact. Experts now believe that even small amounts of retained gadolinium may contribute to subtle but disturbing symptoms, such as confusion, dizziness, and mental disorientation. This is particularly worrying for individuals who already have circulatory issues or are considered high risk due to age or existing medical conditions. A study that was published in the journal Radiology in 2019 tracked over 2,000 individuals over the age of 65 who had undergone MRI scans that included contrast agents. What they found was striking. About 5% of those patients began reporting stroke-like symptoms within a week of the procedure. These included headaches, vision issues, difficulty maintaining balance, and general feelings of fogginess. While these were not full-blown strokes, they were certainly warning signs that something was not quite right. Further investigation revealed that a large portion of these patients had undiagnosed kidney problems, which hindered their ability to safely process and excrete the contrast material. Take, for example, Harold, a 79-year-old veteran from Arizona. Harold had been suffering from chronic back pain and was advised to undergo an MRI. His doctor opted to use contrast during the scan just to be safe. Harold assumed everything was fine. He had no idea his kidneys were not functioning optimally. But almost a week after the MRI, Harold began to experience symptoms like lightheadedness, general weakness, and mental fog that lasted for 2 full days. When his primary care doctor ordered lab tests, it was discovered that Harold had stage 3 kidney disease. The shocking part? No one had warned him that having contrast with an MRI could be risky for someone with compromised kidney function. Harold later said that had he known, he would have asked more questions and perhaps taken another route. So what can you do to protect yourself or a loved one in a similar situation? If your doctor recommends a contrast MRI, ask whether the scan can be performed without the contrast agent. In many cases, the answer will be yes. When contrast is absolutely necessary, request a kidney function test beforehand. This test, known as a GFR or glomerular filtration rate test, is a simple blood test that can offer crucial information about your kidney health. Not only does it help you make an informed decision, but it also offers peace of mind. Make sure your doctor is aware of any prior unusual reactions you've had at imaging tests. And remember, the MRI itself is not the problem. It's the added contrast material that may pose a risk if your body cannot properly eliminate it. By taking the proper steps, you can still get the answers you need from medical imaging without putting your kidneys or brain in danger. Now, let's shift to another medical test that may seem completely harmless at first glance, even beneficial. In fact, it's often promoted as something all older adults should do regularly. However, this test could potentially lead elderly individuals to undergo dangerous and unnecessary surgeries. We're talking about the routine ultrasound of the carotid arteries. This scan is quick, non-invasive, and doesn't involve any dyes, needles, or loud machinery. It seems like a perfect preventive measure. But here's what most people over the age of 60 aren't being told. If you don't have symptoms, such as transient ischemic attacks, known as mini-strokes, or other forms of warning signs, and your doctor's only recommending the scan as a checkup, then that seemingly innocent ultrasound may actually set off a chain reaction. It could push you toward undergoing surgery that you didn't truly need. The carotid arteries are the major blood vessels that supply oxygen-rich blood to your brain. Just like other blood vessels in the body, they can develop plaque over time. These small accumulations of cholesterol or calcium are common, especially as we age. But here's the key point. Not every bit of plaque needs to be removed. In fact, in many cases, it's far more beneficial and less risky to simply monitor the situation over time. The real danger emerges when a scan shows that your artery is partially blocked, say by 50% or even 60%. That number may sound alarming, but in the absence of symptoms, it often doesn't justify immediate intervention. Still, some doctors may recommend surgery or stenting, hoping to prevent a future stroke. What they may not tell you is that the surgery itself carries serious risks, especially in older adults. Complications such as bleeding, nerve damage, and even stroke when the procedure itself are possible. Furthermore, the benefits of surgery for asymptomatic individuals with moderate narrowing are still debated among experts. This is why blindly relying on screening, without considering your overall health status and symptom history, can lead to unnecessary operations and stress. So what's the takeaway here? If your doctor recommends a carotid ultrasound, ask why. Are you having symptoms? Have you had mini strokes or neurological issues recently? If not, then it's important to understand that some findings, such as mild or moderate narrowing, might be better handled with medication, lifestyle changes, and regular monitoring, rather than jumping straight to surgical procedures. Knowing when to act and when to wait can make all the difference. Your health decision should always be based on both evidence and individual context, not just test results. Always ask, always know your numbers, and always advocate for clarity before moving forward. A terrifying situation indeed. Your primary care doctor refers you to a vascular surgeon, and suddenly you're faced with procedures like carotid endarterectomy or a stent. But if you've had no symptoms, no dizziness, no vision issues, no weakness, then these procedures might offer little benefit and may carry serious risks. A major study in the New England Journal of Medicine tracked over 3,000 older adults with moderate carotid narrowing but no symptoms. They found that surgery didn't lower the risk of stroke more than just medicine and lifestyle changes. Worse, some with surgery ended up having strokes as a result, either during or right after the procedure. Helen, 82 from Pennsylvania, learned this the hard way. She felt great, had a routine ultrasound showing 65% narrowing, and underwent surgery. Sadly, she suffered a small stroke during the operation. She now lives with partial weakness on her right side. I wish I'd known doing nothing might have been safer, she said. So what should you do? Ask your doctor, what are we looking for, and what happens if we find it? If you're already treating your blood pressure, cholesterol, and living healthy, a scan might not change your treatment. Don't panic over mild narrowing. Consider repeat scans and always seek a second opinion before surgery. Remember, your health is your responsibility. Even common tests, like scans with dye or mild sedation, can trigger reactions in sensitive systems, especially after 60. Always ask questions. Make sure the test is right for you, and know it's okay to speak up. Your history matters. Your voice matters.